Today I want to discuss the treatment of cervical stenosis, that's narrowing of the canal where the spinal cord passes, when we manage this by going from the back part of the spine. And the spinal canal where the spinal cord passes is a circle. So with this procedure from the front, we open up the back part so that there's more space for the cord by removing these structures called the lamina to create more space for the spinal cord. And commonly, we have to fuse the spine in this scenario because the stenosis and the associated arthritis has resulted in the cervical spine angling forward, which will progressively angle forward unless we fuse. And so we'll take the pressure off the spinal cord. That's called a laminectomy. And then we will fuse by taking the bone that we drilled out here in a biological substance that grows bone and place on the sides where the vertebrae, the joints in the vertebrae are. And then we hold things together until the bone grows where these screws and rods on both sides. So this is a cervical laminectomy and a posterior cervical fusion for stenosis, which is to decompress this canal where the spinal cord passes. The risks of that operation are bleeding, infection. There's a risk of spinal cord injury. It's very rare. There's a risk of that bone failing to grow and having a failed fusion. The usual hospitalization is overnight. We like to have patients walking the same day. You're in a brace up to 3 months, depending on the type of fusion and the quantity of bone we're trying to grow. But from day one, you can walk as much as you want. We're concerned about falling because of the decreased dexterity associated with spinal cord compression. And we're trying to keep it from getting worse. So a lot of the balance issues you still have going into the surgery will still be present. Most patients get some improvement, but the design and purpose of the surgery is to keep them getting worse.